topic is enhancing infection control practices in hospital settings. So ensuring patient safety and hospital efficiency. Yeah. So when it comes to infection control, what is infection control? It is set of practices, what we meticulously do. It's nothing like a rocket science or something like that. What we do as a habit and what we make to prevent infection. That's all about infection control. And what is a key role? The role is like giving protection to the patients, health workers, and minimize the spread of infection. And if you see the impact of hospital-acquired infections, as per CDC, it affects 1 in 31 hospital patients. So it's major things to address. And when it comes to global concern, 7% of the hospitals in developed countries and 10% of the 10% in developing countries are affected with HAIs. And main focus, simple things, hand hygiene, sterilization, PPE use, isolation precautions, and antimicrobial stewardship. Next slide, please. So importance when we say, I'll just put it on the nutshell. It is in the nutshell, if you see, it is patient safety, and it reduces the risk of healthcare association infection, protecting both patients and staff. And when it comes to global health impact, HAS, I said, like it is 7% affecting the developed countries and 10% for the developing countries. And economic burden. When it comes to the economic burden, if you see it's a global data, whereas it comes to US, almost 28.4 billion annually is the cost for it in order to protect the prevention. And when it comes to antimicrobial resistance, preventing infections, helping combat the growing threat of drug-resistant organisms, which is a major concern of today's world. And hospital reputation. That is a major thing. You know, when you don't have a good infection control practices, when you don't have a clinical outcome, the reputation of the organization is at stake. Next slide, please. And as it is the same thing when I said like global statistics, 7% of the developed countries and 10% of the developing countries. This is as per the WHO data. And economic impact also have said, in US it is 28.4 billion, whereas in Europe, 4 million patients acquire HAs annually, leading to 16 million extra hospital stays. It's a huge amount. When it is in the developed countries, you can imagine what will be into the developing country like India. Patient outcomes. HAs lead 80,000 deaths annually in high-income countries. Global mortality rates from HAs are 2 to 3 times higher in developing countries. This is global health data. Infection reduction, effective infection control measures reduce HAs by 30 to 50%. I say like simple hand washing, it can be very effective. So going forward, we may see it. And most affected areas are ICUs. ICUs 5 to 10 times more likely to acquire infection, the patients who are in ICU. Next slide, please. So this is a simple graph. If you see the global infection and the control statistics, by 2030, around 1 in every 5 infections in G7 countries will be caused by bacteria resistant to antimicrobial treatment. It's a huge alarming thing. You know, if we don't wake now, it's going to be a big trouble for the future. Next slide, please. And coming to the cost, it is always better to prevent rather than, you know, getting into the last moment. So if the current trend continues, antibiotic resistance will continue to have deleterious effects on the budget of healthcare systems in G7 countries. So countries are scored from left to right on the basis of the rising yearly cost of antibiotic resistance per capita in 2015 to 2050. Next slide, please. So what is important in hospital? what is important in hospital setups? It's like a nutshell. All of you are nurses, all of you are pharmacists, many of you are from different sector. But you know that in hospital it's very important. When it comes to the hospital control in hospital settings, infection control, the first one is the protocols. What you follow. I do have my moderator sitting here, Dr. Krishna Reddy. I started my hospital administrator job under his CEOship. I believe the first thing as a person I learned up is how to have the SOPs implemented, how to have the protocols implemented, how to implement the care pathways. There the starting happens with the hospital infection control settings. Then coming into comprehensive practices. Once you set up the protocols, the comprehensive practices take on fold. And then measure taken to prevent spread of infections. You need to have robust measures where you need to ensure the prevention infection practices are totally implemented without any foolproof. Then risk assessment. Not only implementing, again you need to see what are the risks associated, how you are going to modify, improve, continue the impact, and then systematic efforts and surveillance and monitoring. See, every time infection control practices is training, monitoring, and modifying. So what is the scope? Which are the few areas in the hospital which we need to have key eyes? One is intensive care units. It's a major thing. You know that critical patients with various diseases in this place, critical infection control measures for vulnerable patients focusing on sterile procedures, catheter care, and ventilator-associated pneumonia prevention. Special care for newborns and children, focusing on sterile environment, hand hygiene, and preventing infection like sepsis and pneumonia. In hospitals, especially in ICUs, if you have a good hand washing practice, half of your tension is over. Coming to surgery and theaters, Dr. Vijay sir was telling the surgery starts with the shaving, but nowadays we are starting clipping. No one now practice the shaving, but then it induces. So what is the importance there? If you see that sterilization of the instruments, proper hand hygiene, surgical site infection prevention, and maintaining aseptic techniques. And coming to emergency department, rapid isolation of contagious patients, proper disposal of biohazard materials, and maintaining hygiene during emergency procedures. Normally what happens is all of a sudden you get 3 to 4 patients together in the hospital setup, all of a sudden we get into chaos. No, we need to have a protocol where we will separate all the patients and treat separately in order to prevent the hospital infection. Coming to outpatient clinic, preventive measures like hand hygiene, cleaning of surfaces, managing respiratory infections to avoid cross-contamination. So cross-contamination is the major role because a lot of patients, many of the OPDs will have a footfall of more than 2,000, 5,000. So how do you protect these all patients one by one? That is another major challenge of the hospitals. And then laboratories. So safe handling of the biological specimen and how you prevent the infection control. And then coming to radiology and imaging, cleaning and disinfecting equipments and surfaces between patients and minimizing infection risk during invasive procedures. So again, you have CT scan, MRI, 1 in, 1 out, the patient is coming and going, out and in. Then in between the patients, how do you take care of the surfaces which make a lot of difference? Then housekeeping department, we call as environmental cleaning, which plays a major role. It can be a toilet, it can be a floor, it can be the wards, it can be the beds, cardiac tables, equipments, whatever it is. And rapid isolation of the contagious patients, proper disposal of biohazard materials, and maintaining hygiene during emergency procedures. And pharmacy, yes, pharmacy too have a lot of important things which affect infection control, the way it is handled, the way the cold chain is managed, and ensuring sterile preparation and handling of medications, particularly intravenous infusions and injections to avoid contamination. Then coming to kitchen, that is the least area where normally nobody bothers. The kitchen cafeteria plays a major role. So strict hygiene protocols to prevent foodborne infections, safe food handling, and maintaining cleanliness in dining areas. Also, the health checkups of the food handlers plays a major role. So what are the challenges? I know that many of the people sitting here are administrators, doctors, nurses, but we do have challenges. It's very easy to say this is how the hospital need to work, but then there are challenges. What are the major challenges? One is antibiotics resistance. Because today the expectation of the patients, once they come, they need to have the cure immediately. So in order to satisfy the patients, we needed to work out of the way. So that is where the overuse and misuse of antibiotics happen and lead to resistant strains like MRSA and VRE, making infections harder to treat and control. And healthcare-associated infections, that is another challenge, especially surgical site infections, catheter-related bloodstream infections, and ventilator-associated pneumonia. And coming to staff compliances, we say like train the staff, train the staff, train the staff, and we make sure like, they are continuously complying the things, but many of the time, it won't be 100%. That is another challenge, ensuring consistent adherence to the infection control practices like hand hygiene, proper PPE use, and sterilization practices across all departments can be challenging. And coming to overcrowding, high patient volumes, especially in emergency department and ICUs, increase the risk of cross-infection, compromise isolation risk. So again, when it comes to challenges, that is resource limitations, inadequate staffing, many times attrition is high, hospital is not able to take care, how to do it, especially in nursing, and in, that is one area of the challenges in healthcare. Limited supplies of PPE and outdated equipment hinder proper infection prevention measures. And environmental cleaning, effective cleaning and disinfection of hospital surfaces, equipment, and patient rooms require strict protocols that are not always followed meticulously. And training gaps, always keep training. And once you train, somebody will leave. Again train, somebody will leave. But this is a major challenge in the hospital setups. And emerging infectious disease. All of you know that when it is 2019, 2020, when the COVID came, first phase, everybody was wondering, everybody was thinking, what is the result, what is the action? And then the second come again, everybody was panicked. When it comes to third, we had a set of rules and regulations and practices in place for COVID. Addressing these challenges requires comprehensive policies, continuous training, proper resource allocation, and culture of accountability. Risk associated, I'll just skip off because it is as same as the challenges which we have discussed. Increased infection control rates, because the risk happens when you don't have a standardized protocol in place. In standardized protocol, if there is not a standardized protocol in place, what happens is like without consistent protocol, there is high risk of healthcare-associated infections. Because people doesn't know what to do and how to do and where to do. That is another challenge and another risk. Inconsistent care. Variability in practices lead to disparities in patient outcomes, as healthcare workers may follow different procedures for the same task. So one nurse, the way she will be managing a patient will be something different than the other nurse, because they don't have a consistent way of the protocol in place. Everybody practices what they know. That is the highest risk and the highest challenge in the hospital setups, if we don't have a standardized protocol which is not implemented meticulously. And antibiotic misuse, then again, clear guidelines is not there, so everybody will do whatever they want. What generation, first, second, third, fourth, whatever the generation they feel like, that is another risk when there is not having a protocol. So in NABH, we always, we always try to check in, like there is an organization have an antibiotic policy, antibiogram-based antibiotic policy is implemented. These are the things are which very, very important for AMR. Staff confusion. In the absence of standardized protocols, healthcare workers may face uncertainty in critical situations, leading to delays and errors in care delivery. And then legal and compliance issues. When you have a lot of problems in the system, there will be a lot of issues in the system. And then resource wastage, and then poor monitoring and accountability. So implementing adhering to standard protocols is essential to see that there is efficient patient care. And goals. So I'll just skip it off. Goals is like prevent healthcare-associated infections. If you have a proper way of implementing, we could always, infection control programs can help for promote consistent hygiene practices, reduce antibiotic resistance, enhance patient safety, educate and train healthcare workers, monitor and report infection rates, promote multidisciplinary collaborations, ensure compliances with regulations. So protocols, it is very important to have a protocol to ensure that consistency in the patient care, enhance safety, improve communication, increased efficiency, regulatory compliances, better infection control, easier training and onboarding. And the protocol, when you have a protocol in place, these are the areas you will be really blessed to have a wonderful hospital setting running on. Standardized protocols are critical for ensuring high quality, safe and efficient care across health setting. Then comes hospital design. It plays a major role. So hospital design plays a crucial role in infection prevention by creating an environment that minimizes the risk of healthcare association infections. So spatial layout. It doesn't matter your hospital is small or your hospital is big or it is in a moderate size, no. If you do have a flow chart, if you do have a way of making the things and getting the differentiation of the flow, you will be one of the wonderful organizations. And ventilation and air filtration. That's very important. So adequate ventilation systems, including HEPA filters, negative positive pressure rooms, help prevent airborne transmission of the pathogens, especially in isolation wards and operation rooms. Then surface materials. Normally, non-porous antimicrobial materials for floors, walls, and furniture limit the survival and growth of harmful bacterial and viruses. And coming to hand hygiene facility, that is one area none of us should compromise. We should have adequate hand hygiene practices, hand hygiene facilities, where that can save a lot of life. Waste disposal and clean water systems. Efficient water waste management system, that is one of the things all the state governments will meticulously have the rules and regulations to handle the biohazard waste, which we needed to implement very meticulously. And natural light and ventilation. So many times, the exposure to the natural light promotes a healthier environment. So we needed to have, when we were designing it, it is one of the areas we need to keep that artificial air circulation can be reduced and the natural air circulation can be increased. Touchless technology. Many of the time, automated roles, sensors for the hand washing and all help to reduce the hospital infections. Well-designed hospital infrastructure can significantly enhance infection control by incorporating these elements into the physical and functional layouts of the facility. And comes the healthcare leadership. I always see a wonderful leader sitting here as my moderator. We learn a lot of things from him. Many of the time, it's not your degrees and books cost you. It is from the things which you learn from the people you work around make a lot of importance. I see an accountable leader in him, the same thing we all been practiced. So leadership have established clear policies and protocols. How the leader lead the organization runs. So we need to have a meticulous, the leadership should have an established clear and policies and protocols. Resource allocation, we need to put the right people in the right place. That is another thing which we need to look in, and promoting a safety culture, continuous training and education, monitoring and accountability, and engaging multidisciplinary teams. Nobody can work in silos. It's a team. Hospital is a setup where the doctors, nurses, pharmacists, housekeeping, security, everybody have to work in a team. Then only the result will come the way we expect. And then surveillance. This is something we needed to do. We need to monitor. We establish a comprehensive system for monitor, detect, and prevent healthcare-associated infections through data collection, standardized protocols, real-time alert reporting, and then interdisciplinary collaboration, continuous training and evaluation. And what will be the outcome? The outcome will be the early detection of infection, reduced HIS, and improved patient safety. And future of infection, you see the stage in time saves 9. When you see the transparent bar, it is the cost, whereas the below darker roles, that is the expenditure. If you invest for infection control practices, you will be saving the expenditure for the organization. It's a huge amount. And then future, when it comes to the future, it is artificial intelligence and predictive analytics and advanced surveillance systems, antimicrobial resistance management, and wearable technology and telehealth, UVC and robotic or disinfection, personalized infection control, outcome smarter, faster, and more precise infection control measures improve patient outcomes and reducing healthcare-associated infections. Ultimately, all are here. This is the last slide of mine saying how you can save a life. Clean hands save lives. So when you have a good hand-washing practices, when you meticulously do it, you are going to be a great blessing for the patient who is under your care. So takeaway, continuous improvement, infection control is an ongoing process, and investment in technology, because now we are into 5G, and then again comes 6G and all, so we can have a lot of automation, and AI are key to future infection control practices and global cooperation. Infection control requires a united global effort for maximum impact. That is why today we are all here for G-SPARC. I hope this conference is going to be a very blessing for all of us. That's all my end. Thank you so much.
Yeah, thanks, Annie.